Tonight, we're taking a closer look at the fight between fringe doctors and mainstream medicine. It's taken over one remote Texas town in the middle of a measles outbreak. Our Brandy Zadrozny speaking with one doctor about this, Ben Edwards, who set up a makeshift clinic inside a sheet metal building, handing out cod liver oil and steroid inhalers, treatments which have not been proven to prevent or cure measles. Turns out he did it all while having measles himself. Parents who are starting to get worried about their kids' measles infections, but also didn't really trust hospitals, didn't want to take their kids there, ended up lining up outside. Down the road, Seminole's only hospital room, made specifically for measles patients, empty most days. Stated in January in an isolated Mennonite community that was already skeptical of outsiders. It was only a matter of weeks before the measles burned through Gaines County, which has one of the lowest rates of childhood vaccinations in the country. Hundreds of kids had to be hospitalized over the course of just a few weeks. 2 little girls died. Those deaths ultimately setting off a series of events that brought Edwards and the anti-vaccine group Children's Health Defense to Seminole. Brandy Zadrozny is joining us now. It is a really compelling story, Brandy. It is also not simply isolated to this one Texas town, right? This fight between evidence-based treatment of diseases like measles and then the distrust spread by anti-vaccine advocates. Talk to me about why you went to Seminole. It feels like it was, for you, very much the epicenter of this story.
100%. Hey, Hallie. Yeah, this story just came at such an interesting time because this small community in Texas that had a couple decades history of sort of staying to themselves and not really wanting outsiders in was largely able to do that. Now, and during that time, that newest generation stopped vaccinating their kids. Now, that was not a decision based on religion, which a lot of people thought, mainly because our health secretary, Robert F. Kennedy Jr., suggested that several times. But it wasn't a religious thing. It was actually a misinformation thing. So they had about a dozen kids in their community who were disabled. One had autism. One had physical disabilities. Like there were just, a couple of kids, several kids who were disabled in some way or another. And these parents went through the experience that a lot of kids and a lot of parents with kids with autism have experienced, that they tried to find a cure for what ailed them. They went to a doctor in Chihuahua, they went to a doctor in Lubbock, and they found anti-vaccine doctors along the way who told them that vaccines had done this to their children. And so they brought that back. It's a very small community of several thousand people. They all go to church with each other. And these stories became powerful testimonies. And so suddenly the word got out, vaccines are dangerous. A lot of the stuff they were consuming happened to be coming from Children's Health Defense, which was Robert F. Kennedy Jr.'s organization before he left to go run HHS. So it's a story about misinformation that worked on a small community. And, why is it important? Because now the leader of that movement is now in charge of public health.
You know this segment, and you've done it before with us, and we appreciate it. On the backstory is really kind of getting behind the scenes with this. So take us behind the scenes on how you approached somebody like a Ben Edwards for this, because sometimes it can be hard, right, to get people who see the mainstream as the opposition to talk to an outlet like NBC. So just help us understand, give us some insight into those conversations.
Yeah, it is really hard. My beat is conspiracy theories and anti-vaccination and a lot of things that come along with that sort of dark web beat, and has been for a long time. Now, I will say that it's not just that, someone like Ben Edwards dislikes the media, and it's not just like someone like with Children's Health Defense doesn't, think the media is too partisan like a lot of normal folks do. They, in fact, think that they're the enemy because they are peddling lies, and journalism, it tells the truth, and we ask to verify things. So it has been for a long time tough to get these sources to talk to me. But what's great about this is that they might not talk to me, but they talk to each other incessantly. And so they have hours and hours of podcasts. So I listened to about 100 hours of podcasts from all over the internet that featured Ben Edwards, that featured Dr. Richard Bartlett, who was trespassed from one hospital for sort of sneaking into the ICU to tell doctors how they should be treating patients. And Children's Health Defense, of course. So I listened to their podcasts for a long, long time, and then I created a sort of narrative out of that. And then I worked behind the scenes with public health officials, with Mennonite parents on the ground, through other reported sources, and tried to sort of verify the things that they were saying, and then put that into a story.
Brandy Zadrozny, we're so glad you helped shine a light on how the reporting process goes. Thank you for doing that. We commend folks to your piece on NBCnews.com. Good to see you.
You too.